So today we're going to be talking about Stillbirths by Alex, Priscilla, and Graciela. We are going to be talking about risk factors, the signs and symptoms of a stillbirth, procedures that may take place if one has occurred, causes, prevention, and support resources.
When a baby is in the womb, doctors use an ultrasound to determine how the fetus is growing and if there is a heartbeat. If the ultrasound shows no heartbeat and determines that the baby has passed, there are many options for delivery. If this occurs anytime before 20 weeks, it is known as a miscarriage, and anything at 20 weeks or more of gestation, it is known as a stillbirth. A stillbirth is determined by the number of weeks of pregnancy, and there are 3 classifications of stillbirth. An early stillbirth is a fetus that dies between 20 and 27 weeks. A late stillbirth is when the fetus dies between 28 and 36 weeks. And lastly, if the fetus dies the 37th week or after, it is a term stillbirth. There are several factors that can put pregnant women of any age, background, or ethnicity at risk for fetal death. Having a medical history of obesity with a BMI of 30 or more, diabetes, or high blood pressure can put the mother and fetus at risk. Whether it's the first pregnancy with twins or triplets, a history of past stillbirths, or pregnancy with assisted reproductive technology are also other risk factors. Women at the age of 35 or older, and especially African American and Native American women, are at even a higher risk for stillbirths. Any history of smoking, tobacco, or cannabis, or the use of illegal drugs is also another risk factor. Furthermore, having little to poor prenatal care can result in stillbirths, as well as having limited access to healthcare, a history of stress, or even trauma. One of the main signs that a stillbirth has occurred is through an ultrasound and listening to the fetus's heartbeat. Even though each situation is different, other symptoms include spotting, bleeding, and decreased fetal movement. The mother may also be in pain, have chills, and a fever, so it is important to contact the healthcare provider right away, as it may be signs of infection. After delivery, babies are stillborn if they have no heartbeat, are not breathing, make no voluntary movements, and/or have no pulsations in the umbilical cord. There are 3 methods doctors use to deliver stillbirths. 1 is induction of labor, 2, waiting for mom to go into labor or natural birth, and 3, having a C-section. The induction of labor is recommended by healthcare providers, especially if the mother has severe preeclampsia, a serious infection, has a broken amniotic sac, or any clotting disorders. Labor is induced by the following methods: having a tablet or gel inserted into the vagina, oral medication, a drip into the vein, or a Foley bulb, which is a mechanical balloon that widens the cervix. A C-section is not recommended because it is not as safe as the other 2 options.
The reason why stillbirths occurs is not always known, but I am going to be talking about some of the most common causes. One of them is labor and pregnancy complications. Being pregnant with twins or triplets is always a risky labor because the babies are at higher risk of being born preterm and without being fully matured. Another complication is abruptio placenta, which is the detachment of the placenta from the uterine wall before labor, which can decrease oxygen to the baby and trauma. In addition, placenta previa, which is when the placenta is in the lower portion of the uterine segment instead of the upper portion, can cause intrapartum hemorrhage and decrease oxygen to the fetus. Furthermore, developmental abnormalities that occurs in 1 of every 10 stillbirths have a structural or genetic disorder that can prevent the fetus from growing in the womb. Another cause is infections, which can attack either the mom, baby, or placenta. The infection can either target a vital organ of the fetus, like the lungs or heart, and can also attack the placenta, which supplies nutrients and oxygen to the fetus. Umbilical cord emergencies like prolapse cord, which is when the umbilical cord slips through the cervix, can cut off the baby's oxygen. In addition, umbilical cord compression can occur when the membranes rupture too early and the head compresses the umbilical cord cutting off oxygen to the fetus, or sometimes the cord can become knotted or wrapped around the baby's neck. Another cause can be high blood pressure, also known as preeclampsia during pregnancy, which can cause uteroplacental vascular insufficiency. Another cause can be medical conditions like diabetes before pregnancy or gestational diabetes because of pregnancy can cause the fetus to mature very slowly due to damaged small vessels and poor circulation.
Today I will be talking about prevention of fetal demise, also known as stillbirths. Reducing stillbirths is a priority for the U.S. Department of Health and is a mandate objective from the government as described in Healthy People 2030. Not all causes of stillbirths are currently known, and it's not possible to prevent every stillbirth. However, we know that certain factors increase the risks, and there are things a pregnant woman can do to reduce these risks. First of all, it is very important to eat well and stay active during pregnancy. Trying to substitute junk food with healthier options will increase nutrition to the fetus. Having a BMI that is obese and even overweight increases the chance of having problems during pregnancy. Diet should be put on hold at this time. Another important part of keeping the baby healthy is attending all prenatal appointments. Certain tests can identify potential problems. While nutrition is crucial to a healthy baby, there are certain foods that pregnant women should avoid eating. These foods are not safe during pregnancy. Some of these foods include raw or undercooked meat, some cheeses, unpasteurized dairy, and certain fish. Limiting caffeine to no more than 200 milligrams a day is advised. There are about 140 milligrams of caffeine in a cup of coffee, 75 milligrams in a cup of tea, and 40 milligrams in a can of soda. Energy drinks have even higher amounts, so it is best to avoid them altogether while pregnant. Cessation of smoking and drinking during pregnancy is a very important modifiable factor. The government provides plenty of free resources to aid in smoking cessation. Another important point to make is that pregnant women should also avoid people who smoke. Secondhand smoke is almost just as harmful to the fetus. Alcohol consumption has been proven to damage the baby in many ways, as well as produce withdrawal symptoms in both mom and baby during and after delivery. The sooner a woman can quit smoking and drinking, the less damage to the fetus and the lower chance of fetal demise. It is important to tell the HCP of any alcohol or drug consumption before and after pregnancy. The more the health provider knows, the better he or she will be able to help the baby. Another important prevention technique is getting the flu shot. Pregnant women are more at risk of having flu-related complications. Additionally, women who get vaccinated during pregnancy also pass some protection on to their babies. Even if vaccinated, the pregnant woman should try to avoid contact with people who have symptoms of infection. These symptoms often include nausea, vomiting, diarrhea, and fever. After possible exposures, the woman needs to let her HCP know. The last prevention technique I will be talking about today is hand hygiene. Being strict about hygiene wherever you are is crucial to preventing infection. The pregnant woman should always wash her hands before preparing food, before eating, and after using the restroom or changing a diaper if she has other children. While it is not possible to prevent early stillbirth, abiding by these guidelines during pregnancy will greatly reduce the risk.
Going through a stillbirth can be a very traumatic experience and can have a tremendous impact of the mother's well-being and mental health. It is very important to seek support within family, friends, and partners. In addition, there is peer support groups, mental health professionals, and bereavement counselors which can help manage the grief and depression some women go through. Some of the bereavement support programs can be the Compassionate Friends, Share Pregnancy and Infant Loss Support, International Stillbirth Alliance, First Candle, and Star Legacy Foundation. It is always encouraging to know most individuals after a stillbirth can still conceive a healthy baby in the future.